Let's start. Good morning, everyone. It's a pleasure to be the moderator of this panel, Importance of Assessing New Technologies in Healthcare. We always have to talk about innovation and technology. This is the reality and will be also the case in the future. A good use of technology is essential for supporting private or public healthcare, here or anywhere in the world. Health technology deals with the dichotomy, which is not common in other industries. In healthcare, new technologies increase cost and do not help bring them down. But there are ways to deal with that so that we can have more of leverage than barriers to healthcare. It's a world challenge, and the response of developed centers is always the same. Use health technology assessment to support decision-making about which technologies should be incorporated to be provided by the private or the public healthcare. We use that for the public healthcare system carried out by CONITEC, which is the Committee of Assessment, and ANS, the National Agency of Private Healthcare. So they use it to analyze the available technology, selecting the most effective and best technologies. In Brazil, however, this instrument is at risk, such as the Bill 6303, which was approved in the Congress, but fortunately vetoed by the president. It required automatic inclusion of oral antineoplastic just by registration with ANVISA. We all agree on the need to have a faster analysis of technology in private healthcare. However, we have to maintain the assessment of technology so that it wouldn't be good just for those who sell technology, not for those who really need it for cure purposes. Incorporation should consider economic impact as well. Healthcare has limited budget, which are getting tougher and tougher because of the credit or because of reduction in revenue. So we have to make choices. At the same time, it's important to have appropriate pricing mechanisms, including risk assessment between all those funders which are carrying the risk on their own, and also providers of medication and other technology. And the costs are only appropriate assessed if all the components are well known, starting from the technology of medication itself. There is a lot of difficulty to get to know costs that would really justify extremely high products such as Ogiza, which is a treatment for SMA. Taking into consideration the likelihood of having kids who might have the spinal atrophy, just treating it alone could cost 1.8 billion per year to the government. I would like to mention Commonwealth, a research that compared 11 healthcare systems in high-income countries. One of the conclusions is to spend wisely and not spend more to reach the best outcomes, and also invest in primary care. As you can see, not only the most advanced technologies can really overcome the principles of good health, prevention, self-care, adoption of healthy habits that respond to half of the best conditions of good healthcare. We have here two great specialists, and I am delighted to have them here with us, two friends of mine. I don't know whether Vecina has got connected or not. Clarice and I worked together when we were really working on the analysis of technology with CONITEC, and also Gonzalo worked with ANVISA. Clarice Petramale is a doctor, University of São Paulo. For 9 years, she worked with ANVISA as coordinator responsible for creating Sentinel Hospital Network for post-market analysis of medication, rational use of technology and patient care. Then she was involved in the implementation of CONITAC, which is the Committee of Analysis, and she coordinated the process of HTA, Health Technology Assessment, for our public healthcare system, SUS. She's also a advisory specialist for the Board of Medical. Well, Gonzalo Vecina, known by all of us, a founder and former president of ANVISA. He was also one of the creators of the Universal Healthcare System in 1988. He is assistant professor of the Public Health School of Public Health in the University of São Paulo, and he's always speaking and sharing his experience. We saw him a lot during the pandemic. Thank you very much for being here. And now let's go into the questions. The first question to Clarice. The argument of those who defend automatic interpretation of new technologies that the process of registration with ANVISA would be enough to incorporate them. And then HTA would be just a bureaucratic process, not assessing safety and effectiveness, because it had already been assessed by ANVISA during the registration process. I would like to hear from you, and it's a difficult process to understand, and this is why some people have difficulty to understand that. So please be straight to the point and tell us about the difference between registration, analysis, and HTA, as well as pricing, just to emphasize that the health technology assessment is not a bureaucratic process, but something that goes beyond the analysis of cost. It also involves effectiveness and safety. Thank you. Hi, Vera. Good morning, everyone who's here with us today. It's really a great opportunity. Oh, now you can see me. Good. I can see Clarice and I can see Vera. So you haven't heard my introduction of you when we worked together to implement generics. Thank you very much, Vecina, for being here with us. Thank you, Vera. I apologize. I'm late. I was in a meeting and I could not connect before. I had just asked a first question to Clarice, and I'm going to repeat that. Those who are advocating automatic incorporation of technology into the systems. I'm sorry, you are frozen. Vera, we cannot hear Vera. But I can hear you, Vecina. And I'm here in the countryside area, Clarice. I'm going to repeat the question to you, Gonzalo. Well, what you would like to hear from us is the difference between the regulation of ANVISA and CONITAC in terms of new technology, and whether an HTA would be not necessary as ANVISA had already authorized or assessed the product in terms of safety and efficacy. So she asked me to address the difference. And here I am back. Good. Thank you. I just repeated the question to Gonzalo. You see, I think this is a very timely question. There are still people, after 10 years of CONITAC's existence, it's been in place for 10 years, and February next year, it will have really confirmed its 10-year course of activities for Brazil assessing new health technologies. And it's a completely different process. I'm sure Gonzalo can talk more about that from the side of ANVISA, but it's always based on a dossier of the company that reports efficacy, safety, etc. But it does not compare the technology with other existing technology used for the same purpose. This is done by Conitec. This is done by ANS, the private healthcare agency, whenever considering to include a new technology, and it does not analyze the economic impact that the innovation is going to have for the national healthcare program or anything else. So as you can see, Conitec bases on a number of things that have been authorized by ANVISA, because we cannot assess new technology which hasn't been registered in Brazil yet. So first, the registration with ANVISA, followed by an analysis before the incorporation of technology for public or private sector. Many people think this is just one more step, that this is just something that's going to make the process even longer before the product's incorporated, but that's not quite so. Of course, the managers, they are willing to consider the incorporation of technology. So it's important really to analyze how much it costs. Is there going to be enough money to use that? These are important things for managers. Not only what the product's used for, but what are the advantages, problems, to which group of patients would it be the most appropriate, and how much will it cost, and what kind of budget would be required. So this is the main question of managers, and managers who are not sure don't make decisions. They just wait for more information and end up taking longer to decide. Conitec, for the past 10 years, incorporated over 350 new technologies by doing that, bringing to managers all the sides of the issue so that managers can really decide in favor or not of incorporate a new product. Differently from what is normally thought, ATA or HTA helps the incorporation. If we just look back and see what used to be done in the past, it was much less than what we have been incorporating as a result of this formal process of health technology assessment, or HTA, really assuring managers of the consequences of incorporating. And this is not wasted time. Quite to the contrary, it helps future planning and successful implementation of new technology. Can I make a comment? We cannot hear Vera, but I'm going to make some comments here. I fully agree with Clarice. It is a very short time. It's 40 minutes that we are going to be here, up to 11:10. Virtual world, wow. Well, Gonzalo, let me ask you something. To make sure that we have access to technology, there are different steps: registration with ANVISA, pricing, then analysis by Conitec or ANS, depending of being public or private incorporation. One of the criticisms is that the process is too long. So some legislative measures have been adopted to expand coverage through injunctions or bills in the Congress. So legislative branch just going over or trying to overcome the actions of a regulating agency. Do you think we could integrate the steps and get more efficiency and negotiate prices not only for universal healthcare system, but also for the private organizations? What is your opinion? Well, I really think that we have to revisit the authorization for commercialization, which is what's done by ANVISA, as well as health technology assessment to incorporate it, regardless of being in the universal healthcare system or private care. The first thing we have to take into account is that 2 steps are required. In a country such as Brazil, first, technology assessment, whether it can be sold or not. And please bear in mind that ANVISA involves all kinds of technology, whereas price discussions are just done for medication. Conitec does not analyze only medication. It should really be focusing on all the other health technologies. There is a drug called molnupiravir. It reduced by 50% mortality due to COVID. Wonderful agent. It has submitted its registration with ANVISA. There is another agent by Pfizer, Paxlovid, which is coming to the end of its phase 3 trial. Paxlovid, in 385 patients, got to 0 mortality rate, whereas in the control group there were 7 deaths. Molnupiravir reduced by 50% mortality rate. Which product should be incorporated as new technology to treat COVID-19? The one that zeros mortality or the one that reduces mortality by 50%? This is a discussion that is submitted by Health Technology Assessment. ANVISA is going to check whether there are adverse events. None of them have severe or serious adverse events. One has 50% efficacy. The other one has apparently efficacy of 100%. Which one do I need? Both can be sold, but what I want is the one that has the highest efficacy. So let's go into price. These medications are used to treat patients early. What is a COVID-19 patient? Complicated cases. Out of each 100 patients with COVID, 3 die. If I give them just holy water, 97 are going to get cured. And this is an important thing, isn't it? If I say there's going to be 50% mortality reduction, there is going to be 1.5 less death in 100 patient group. But with Paxlovid, all the 3 deaths will be prevented. How much do they cost? They have to be used early. We know how much the treatment of molnupiravir cost. It costs 4,000 BRL. If I have to give it to 100 patients by 4,000 to prevent 3 deaths with ICU admission. 2,200 for each ICU daily rate. So health technology assessment goes into this kind of discussion. This is something we have to adopt. The other thing which is essential, and I think there are 2 more points here. On the one side, there should be a process of health technology assessment for private and public. I don't think there should be 2. I think there should be just 1 process in common. Those who have private HMO have access to technology that the SUS patients do not have it. Let me just talk about one technology here. Minimally invasive surgery, for example. What is the number of gastric surgeries performed by video laparoscopy in Brazil? Just few cases, really, a minority of cases. But obviously, having a gallbladder video laparoscopy, the immediate cost is lower. It's higher, rather, he corrects himself, but the outcomes are much better from a clinical perspective. The patient stays in the hospital overnight. If it's a video laparoscopy procedure, it costs more expensive in the short run, but the outcome is better in the long run. If we analyze health technology assessment, if we don't undergo health technology assessment, it's not going to work. So we need one whole system of health technology incorporation. Clarice said that before Conitec, it was a disaster, and I am fully in agreement. The national formulary, the list of drugs approved in Brazil had been lagging behind. So Conitec was created and has incorporated a lot of technology, but it has not incorporated everything we needed. If we compare breast cancer treatment in the private and public system, it's really unacceptable what we do for women in the public healthcare system for a number of barriers set by Conitec, which are mainly budget limitations. I think we should have one single system of technology incorporation. I believe in two steps, really. So authorization for commercialization and registration with ANVISA, and then health technology assessment. I think it should be done through an independent agency. Conitec is not independent, and this has been confirmed by the latest analysis of Conitec with the COVID kit, which stroke of violence a tie, because representatives of the minister wanted to confirm that the COVID kit is part of treatment, which is really a shame. Shame on them. So we really have to think about an independent agent, such as NICE in England, to carry out health technology assessment, including representatives from patients. Vera, can you hear us? No, she cannot hear us. Couldn't agree more with you, Gonzalo. We really need one single agency to carry out health technology assessment. Breast cancer has even improved, but it's not similar to private care. You are right. Conitec has managed to incorporate some new agents. Treatment of breast cancer has evolved because it was in Stone Age before that. We have negotiated significant reductions of prices of products so that it would become sustainable for the system. Some areas we are lagging behind, and oncology is one of them. And because Conitec has not been asked to assess anything, some companies just are okay to operate in the private market, which is large in Brazil, and they end up not want to submit to Conitec and be denied inclusion. And maybe this is why they don't take it. But the Ministry of Health has been analyzing some additional options, but still lagging behind. At the same time, for chronic diseases, there is less offered from private than what's offered for SUS. So, for example, arthritis, spondyloarthritis, psoriasis, and a number of other diseases. They haven't evolved in private, but they have achieved an improvement in public. So that's exactly what you said. Having an independent agency, which is absolutely key. And we know how people have been suffering to maintain a decent decision in terms of policies. What's going on, it's really serious. A lot of pressure for very little result. So Conitec, after 10 years, is taking this leap, being independent and really being able to overcome difficulties and check data. So that can be applied to private and public health. But the initial price discussed at SUS will also be discussed in private healthcare, which also has thousands of lives. Well, I think that it deserves revision. NICE in England discusses the price of incorporation of technology. It's not the Ministry of Health of England. Even though NICE being not responsible for pricing, it is responsible for negotiation, price negotiation. And when it does it, it takes into consideration the opinion of the Ministry of Health in incorporating the product. So I think it was high time we did it. The only way we have to try to avoid the so-called judicialization, so taking the cases to court. We know it does not bring any democratic access, right? I think we should just go to courts for extreme cases, and the government and the judge has to understand that public policies should deal with the difficulty of technology and medication access in the private and public sector. Considering the existence of a good public health policy, if we had an independent agency, we would be able to reconsider the whole process. One thing is setting pricing for medication. Another thing concerns technology, of course, because then if I'm talking about medication, what is 2,000 products? It's technology, it's 500,000 products. And the tools we have to assess that are poor, bad tools. So we have to be extra careful on how we are going to deal with non-medication technology, especially now with biotechnology and genetic CAR-T, CLISPs, and all. But I think we have to rethink that. I think we have to stop thinking. I think we have really to feel confidence. There is a bill in the Congress to create our own NICE in Brazil. We really have to improve that and keep very close to this discussion. At first, we did not understand how it worked, because whenever a new minister came into office, they wanted to negotiate the price themselves. That would make them feel more important. And that would give rise to corruption. Recently, there was an incorporation in SUS of an implant for glaucoma. So a small implant to control the ocular pressure of those who have glaucoma. There was relevance because they were elderly patients that had to use so many eye drops. And the company that used to sell by X and wanted to just sell it for half because of a very large population. So through MP, if there was any positive incorporation at SUS, because that was decided by MP, because there is just the entry price, not for one patient, but for a 50,000 people group. Because not everyone will need the stand. So you see, we start having that kind of price reasoning for public and for private sector. So there is no technology today that offers a price below the cement product and below the commercialization product if it is a device such as this or anything else. And this is what starts really giving us an understanding of how much that would cost. Is it possible for Brazil to have, even though that's important? Sometimes it's important, but you cannot afford it. I remember in drug-eluting stent days that there was a price interval that was huge between a stent of one brand and the stent of another one, which was very similar. They were all eluting the same drug, but it ranged from 19,000 BRL of Abbott to 4,000 ones in another one. And finally, we could incorporate that by 2,000 for a whole population. Because there is a market that didn't used to exist. Well, but there is another problem. It is the distribution system of prostheses and special materials. Materials have no stock, no inventory. In Brazil, just the company has it, and it has to support a whole system where there is the payment to a physician, extra payment to a physician. And this issue is what increases the price of this technology, of the non-medication technology. We should also bear in mind that antineoplastic chemotherapy, 10% of it has also money to give to oncologists. We know that. In the public system, SUS, we haven't been paid that extra. To some extent, we have also reduced this extra payment for thesis, prosthesis, and special materials. But this is not typical. The model of use of non-medication technology has to be revisited. It makes no sense having people every week, in all weeks, people just carrying out a pacemaker replacement surgery with wires because they need a special system that costs 100,000 to have it removed. Quite to the contrary, we have to try to get specialization and create volumes, scale to be fully used. So I think that there we can see an intervention that goes beyond Conitec. It goes beyond. It needs additional intelligence to create a reference system of utilization. Incorporation is one thing, Utilization is another thing. Why OPME in Brazil or these proteses are more expensive than in US? Differently from medication. These are more expensive because of the use in Brazil, and there is no law that's going to help with that. This is something that we have to discuss, and I think that there is also room for cooperation between public and private initiative to create scales for specific places to use complex technology, which are important alternatives for treatment and can be provided by a more appropriate cost than what we have been observing. This is a problem all over the world. Isn't it a problem just limited to Brazil? The problem of the bribing or the paying bribes here in Brazil, I don't see it very much outside Brazil. The main problem with these implants is to assess whether they are different technologies. Sometimes there are just minor differences, one stand like this, the other one like that. Are they competitors in the same niche? This is not something clear. Studies demanded all over the world for these products do not follow good methodological technology, differently from what we expect for medication. And there are just so many questions about this interchangeability. Is it possible to use one or the other for the same purpose? So that would mean more competition in the same niche. But no manufacturers are going to do that. The regulation all over the world in the products are just loose regulation. And this is clearly stated in many publications. So devices would be a different chapter, and we have to come up with new methodologies for registration, for health technology assessment. We are not doing anything different. So one thing is registration. FDA does it differently, Japan, and we don't do differently. Another option is technology assessment for incorporation. It has to be unique with a set of criteria. So evidence-based decision, use of independent specialists, involvement of society, independence, transparency, systematic review of what had been done, and development of technologies continuously. There is another problem which concerns use. Creating scale for the use in a more economic fashion, the new technologies. There cannot be one center in each corner. We need centers that can perform as effectively and safely as possible, because people have a volume of procedures that provide more effective and safe procedure. And we haven't started that yet. You're right. We still have got few minutes. I don't know whether we should talk about judicialization. So having an agency that would see both systems would help us reduce this diversity. And this is the main understanding for the judge to really just gain or succeed really in this lawsuit. So public health does it like that and cannot do it. Private does it and it works. But you see, sometimes it works fine in private and not in public. So I don't get it. This situation, this schizophrenic situation, is one of the main factors that influence this crazy judicialization that we've been trying to reduce and make rational. But the whole teaching of policies is differently from what we really expected. A patient, regardless of being public or private healthcare, would have the same right of getting safe, effective technology. Therefore, we wouldn't expect differences among treatment. And then judges might understand that there is one single national policy that is applied equally by private and public sector. I would like, if I may, I'd just like to make a consideration about judicialization. Restoring rights should be a reality. So this is what the legal suits work for, but it shouldn't be something used to create public policies. It has to respect the executive branch, and whenever there is a public policy, this should be something to prevent going to courts. For the past 5 to 6 years, we have improved what a public policy is and what guides it. What guides it is evidence-based medicine. It's the use of a technology based on previous knowledge. I think we are still maturing it. However, we need better public policies, and the combination of the public and private sector will create a space for us to have better public policies for technology incorporation. This is my take on it. Vera has sent me a WhatsApp. We tested the link, it's not working. So please feel free to close the panel. Well, we've been speaking for 43 minutes now, so let's have our closing remarks, shall we? Well, I think it was wonderful to talk, even though we are far away, and just so many points that we have in common, even being in different regions and in different areas. Thank you very much for your comments, and see you around. I would like to thank FenaSaúde for the opportunity to discuss such an interesting issue. I hope we can influence the Brazilian Congress to create a law replacing Cone tax so that we can have a single system of technology incorporation. And there's a single way of incorporating technology would be better for private and public healthcare. Thank you very much. Stay safe, stay well. Thank you.